Hi, my name is Erica Cole. I'm the founder of No Limits. We make adaptive clothing with the mission of increasing comfort, confidence, and independence in those who struggle with clothing due to a disability. We've really transitioned into this ready-to-wear collection, so we laid in the supply chain to be able to offer our pants for amputees. We've also developed a sensory and wheelchair collection, which is super exciting. We launched a Kickstarter. We were 100% funded in just 4 days, which was phenomenal. We're looking at some really large partnerships this year and going into 2022 really strong. One of the things that I'm most proud of is over a third of the people who order all of the colors that we have. So that's been a really strong sign to us that we're on the right track. There's a really unique connection that I get to have with my customers that I absolutely love. And when I started this, I was just graduating fresh with a chemistry degree, nothing to have to do with business at all. And so I'm really enjoying the process of learning every day. And there's not one way to build a business, which took me a while to realize. Sales are growing. The number of people that we're able to help is increasing, which is really the most important metric, I think, for me. I'm just looking forward to seeing how much further we can take it.
My name is John Lensing. I'm the CEO and one of the founders of OpenLoop. And the easiest way to describe what OpenLoop does is we are like a telehealth company that powers other telehealth companies through our fractional clinician marketplace. And breaking this down, we have what we call full stack clinical operations. So our clinical team of 6,500 clinicians sees our telehealth clients' patients for them all underneath their brand name. Prior to COVID, actually the US was experiencing a massive shortage of clinicians nationwide. An estimated about 2.5 million clinicians in shortage over the next 5 years. With the pandemic, we saw telehealth utilization increase about 8,000%. And so patient demand skyrocketed, but the clinician support there to meet that demand didn't exist. And so OpenLoop was situated well in order to help take clinician time and fractionalize it. So we break it apart, that way we can plug it in between multiple different telehealth partners so they can continue delivering access to the patients that desperately need it. We went to a conference 2 weeks ago, big healthcare conference, and multiple groups had scheduled meetings with us. They came by, they said, we had always been looking for a solution like this. We just didn't know how to articulate it or what to search, and so we're so happy that you're here. I really think that OpenLoop is positioned to become the dominant driver within the space that powers the majority of patient visits within the next 10 years. And so very fortunate for JPEG's continued support.
So we're Scroot Laboratory Incorporated. We develop shortcuts for biomanufacturers. I'm Nigel Rule, I'm founder and president of Scroot, and today I'm here with John Casco, our VP of Business Development, and Will Israelson, our VP of Operations. Much has happened in the last year. We've progressed substantially in the product qualities. We've been in many conversations with lead biopharmaceutical companies to evaluate our technology and to see if it can make them discover and develop new drugs faster.
And so it's bringing tremendous efficiencies to biomanufacturing and bioproduction, and in the end it will mean that these cell therapies, life-saving CAR-T cancer treatments and such could be manufactured much more efficiently and at much greater scale, and making them more affordable and more accessible.
As a scientist, I love data. I love having more information, and this replaces the manual sampling I used to do. I have to go in every hour and check it manually. Now you just get a continuous readout. Both the labor savings and also the information that will come in real time will be a big game changer for all the operators, all the scientists that are doing the work.
Biomanufacturing is definitely on the world stage. When we need a vaccine, it needs to be made well and it needs to be made quickly. Where I see our future is being able to address these growing concerns of new health risks and new therapies, new modalities of treating disease by creating these drugs faster, getting them to patients, and making it at a cost that's tolerable for us to handle.